Great. So welcome, everyone. Thanks so much for joining us tonight for Meet the Specialists for Healthcare. We are pleased to introduce Ellen Church and Andrea Bresnahan, who are the healthcare specialists for the session. And I want to thank them so much and applaud their work because they are relatively new and they definitely have jumped both feet in and are tremendous advocates for this area. So I want to say thank you to them for that. We will be recording the presentation and sharing it tomorrow along with the presentation slides. So just to remind everyone of our community norms, we are going to be kind and respectful, assume positive intent, bring your full self and limit distractions. If you can mute when you're not speaking, use the chat feature to ask questions or the raise hand feature. We will have a Q&A section at the end after we've reviewed all the bills. And you can message staff with any private comments or concerns. So our agenda for tonight, I'll just give a brief overview. Many of you already know this information, but we want to welcome any newcomers, an overview of the Legislative Action Committee and what we do, our positions for action that we have at the Massachusetts League and at the National League. We'll review our League of Women Voters of Massachusetts supported bills for this session. That's why we have Meet the Specialists. We want to take that deep dive into each one of the bills, and then we can do some Q&A. So again, I just want to say I'm Jen Miroff. I'm the chair of the Legislative Action Committee, and I work with 22 volunteer specialists who drive our advocacy work at the state level. And we select and monitor about 170 bills in 20 broad areas for each 2-year legislative session. We submit written testimony and present oral testimony during committee hearings. We suggest advocacy actions that local leagues and members can take and organize educational events. And we're guided by LWVMA's program priorities that are set at convention. So how do we choose the bills that we're supporting for this legislative session? First and foremost, we always check to make sure we have a position to support or oppose it, either at the national level or at the state level. We want to make sure it has broad policy implications across the Commonwealth. It's affecting a large swath of residents. Does it have strong support from coalition partners? And where can we be most impactful? Where does the league name really make a difference? What's the likelihood of passage, the number of co-sponsors the bill may have, or whether it was reported favorably out of committee last session. These are just some of the factors we weigh when we're deciding on our bills for the session. So these are our position books, impact on issues at the national level, and where we stand is the Massachusetts level. So I won't read these positions in depth. They're pretty lengthy, but I just wanted to give folks a resource for, where our positions are located and impact on issues and in where we stand. So they're very comprehensive. And then where can you check out all the bills we support, especially in healthcare? You can go to lwvma.org/advocacy, and you can click on supported legislation for this session. You can scroll down the list and see the specialist name, the topic area, the bill numbers that you can support, that we support. You can click on the link to go to the malegislature.gov website to view the bill and its progress. You can read the summary, click on the summary, and also we have a link to the testimony that we provided to the Joint Committee. So the topics we're going to cover tonight: universal single-payer healthcare, uniform collection and reporting process for immunizations, ensure minimum local public health standards, uniform data collection and reporting, licensed midwives practicing in out-of-hospital settings, tax credit for caregivers of family members at home, and death with dignity. So with that, I'll turn it over to Ellen Church.
Hello, good evening. Thank you, Jen. I am very pleased to be here. I am calling in from Hudson, Massachusetts. I'm zooming in from Hudson, Massachusetts, where I've lived for the past 5 years. I'm a Boston born person. And so I've lived in Massachusetts my whole life. I'm here to talk with you about H 1239, S 744, an act establishing Medicare for all in Massachusetts, some basic information about it. The co-sponsors of the bill are Senator Jamie Eldridge, who happens to be my state senator, and Representatives Denise Garlick and Lindsay Sabadosa. The basic point of it is, as its details here, but is creating a single payer healthcare system that guarantees complete coverage for all Massachusetts residents. And as a wonderful benefit, it saves money for state, local governments, businesses, and residents. One of the important things I want to highlight before we go forward is it delinks health insurance coverage from employment, offering more opportunities for people to switch jobs without being concerned about how it might impact their health insurance. You could start a new business, or you could simply retire early. Next slide, please. So this has a long history in Massachusetts. And when I was maybe about 10 years old, Massachusetts began exploring how to finance healthcare in a more equitable way. In 1995, around the time I graduated high school, MassCare formed to work on establishing a single payer system. We are known as a national leader in advocating for universal health care, and the Medicare for All bill has been introduced repeatedly for more than a decade. Next slide. Couple more facts about this bill and the movement supporting it. It is supported by an organization called MassCare that runs the Massachusetts Campaign for Single Payer Healthcare. It is part of a coalition of more than 90 member organizations, including labor unions that represent diverse constituencies. Together with these organizations, excuse me, they stand for over 500,000 supporters here in Massachusetts. Next slide. What I'm asking for you today is take a minute to think about how everything with our healthcare is always a trade-off. We could have essential services at the public level from our local towns and cities, but unfortunately, some of those are constantly slashed to pay for rising healthcare costs. So what I'm asking you to consider tonight is to contact your legislators, to urge committee members to report the bill favorably out of the Joint Committee on Healthcare Financing. Our deadline is March 27th. So when you're celebrating St. Patrick's Day, think I've got 10 days. Okay. As of January 21st, 52 representatives, that's 32.5% of all Massachusetts representatives, and 17 senators, just over 42% of all state senators, co-sponsor this bill. They've had a lot of time to talk to their colleagues, and they've really amassed a lot of support. So I thank you for your time tonight, and I hand it off to my colleague, Andrea. Thank you.
Hi, everyone. Thank you for having me this evening. I admit I am not a Massachusetts longtime resident like Ellen. I moved here during the pandemic from Florida, and knowing that Massachusetts has the most amazing healthcare in the country, I just knew I was coming to the right state. And once I met the league members, I've been teaching a course, a policy course at the medical school, and had some league members come and talk to the students, and wow, they got so excited. And just seeing the advocacy that you all have done, what incredible work you guys have done, and just being part of this team is really important to me. And I'm just really happy to be here, and the warm welcoming that I've gotten from everyone and the camaraderie of this group is really inspiring to do this work. It's a lot of work, right? And we need to just get out there and start advocating. And so tonight, we'll talk to you a little bit about the rest of these healthcare bills, and hopefully you'll see, just how important it is to contact your legislators about these issues. I'll start here by talking about the Act to Promote Community Immunity. And when I moved here, and I'm sure most of you thought that we are collecting data on who's immunized in the state. We are using that data to give information out about who has certain immunizations and who doesn't, and whether there's a higher risk for herd immunities not to be acquired. So if you think about it, that's really important to us, those of us that have kids and those of us that have grandkids, because we want to know that they're safe in our environment. But it's not something that's been happening. I think probably that during the COVID pandemic, we were tracking those vaccines. And so we were able to see when people were not getting immunized in certain areas of the state. And so I'll talk a little bit about that as well. You can, if we just, well, I guess I'll just talk a little bit about the sponsors are Rebecca Rush, Senator Rush, and Paul Donato, Representative Donato. And we're really asking you all to contact any of the members on the Joint Commission on Public Health and report the bill favorably out on February 7th. If you could ask them to do that, we would be greatly appreciative of that. Overall, the bill looks at trying to make sure that we're having immunizations in all of our schools, and that's K-12 and higher education, and really authorizes making sure that medical exemptions have a standardization and that DPH is following who's being exempt from these immunizations. Next slide. A little bit more about the act is that it standardizes what must be submitted for exemptions, and it also requires programs that have insufficient immunization rates to be designated as having an elevated risk. Next slide. I think this is a really great slide because it's a one-pager, and as advocates, we love those one-pagers, right? It just gives all the information quickly to somebody, and they've been using this one quite readily. I think also during COVID, everyone was talking about herd immunity. So one of the problems in Massachusetts is that we do not have herd immunity for a lot of our infectious diseases. We also lack comprehensive data analysis and gathering on all our other immunizations. I mean, I think we've done well with COVID-19. Somebody's talking. We've done really well with the COVID-19 vaccine, but the other immunizations, we just haven't. We're not tracking those. And I wrote a brief for the Ways and Means Committee that kind of talked a little bit about the hospitals and how we use those immunizations to help provide care to our patients. And so it's really important to have these in a system across all of the medical centers as well. Our schools and our camps where students or kids are going to in the summers, they also need to be managing the vaccines and making sure that everyone has their vaccines. And then there's also a really needed requirement to let families know and parents know when say a group of students in a school area or in a camp doesn't have their vaccine, so that they can be informed whether there's going to be an outbreak or something like that. The solutions created here are really to support student health, which would create consistent immunizations and exemption policies and protocols for all of the Massachusetts school kids all the way through college. It's also going to improve public health and require immunization and exemption data reporting from youth programs and parents and caregivers and DPH, and from DPH to the public. And then the other really important thing we have to think about here is engaging communities. We just really need to provide information and pathways to parents and caregivers and community members about immunization rates, about vaccine safety, about efficacy and access. If you think about it, during the pandemic, I'm sure you heard that there was populations of people that weren't getting the vaccines, and we were very concerned about that. So when I moved up here, I started doing vaccines. We would be driving all over the state, and we figured out that there were populations of our citizens that live here that weren't English speaking first. And they needed someone to come out and educate their community. And sometimes it would take 2 or 3 trips out there. I mean, to the coast, it's an hour and a half to drive, and we would bring the vaccines and help educate them. Because if they're not listening to medical professionals, or they're not listening to scientists, then who are they listening to? And the stories they're hearing may not be factual. And that's our job, right? To spread factual information to people. So hopefully we can start a statewide effort to engage communities in learning about the value of vaccines. Next. So this next bill is talking about an act to accelerate the improvements of our public health system. And it's sponsored by Representative Hannah Kane and Representative Denise Garlick and Senator Joe Comerford. We are urging legislators to bring House Bill 4101 to the floor for a vote and report it favorably by the Public Health and Healthcare Financing. It establishes a minimum public health standards for every community, increases capacity and effectiveness in incentivizing shared services, and creates uniform data and collecting and reporting systems. So now you've heard me talk about data twice. And I think this is a really important thing to think about in our state because we don't have good data collection systems across the board. Over the last 2 years, I was running the Nursing Council for Workforce Sustainability, built a data committee to kind of study what's happening with our huge nursing crisis in the state. And it's dramatic. But we found we didn't have any nursing supply data since 2014. How can we make policy in this state if we're not collecting the data we need, analyzing it, and then making good policy? So, I mean, that's not our job, right? We're just supposed to run out there and get to work and advocate and not sit on the couch. But it is their job to collect this data, and we have to push them to understand that we need it. This is a really important bill because our healthcare system is really moving out of the hospitals into the communities. It's been happening for quite a while, but we have to help this happen in a quicker manner than it's happening. I don't know if you all are aware, but our healthcare system here is really at a level 2 emergency state. When you go to an ER, you might be sitting there for 2 or 3 days before you move to the floor. It's because our healthcare system that's in the communities is really broken right now. Our long-term care centers don't have enough employees, and our mental health systems don't. And the community health systems really need to be supported here. We've got to get people out there and got to, help fund this. Ellen, do you want to add anything to this? Because I know you're
sure.
really...
Well, sure. This is a broad bill that covers quite a lot. And for those of you who don't know, I'm an epidemiologist. One of the things that you may or may not know, besides a well-known fact that Massachusetts is a home rule state, but one thing you may not know is that the negative impact of that is that local public health departments are right now funded either through local tax dollars, or through random grants that maybe somebody wrote haphazardly here, there, everywhere. And then those grants need to be accepted by the local select board or city council, however, and they can be rejected as well. So that, what that means, that it's all over the place in our 351 cities and towns in Massachusetts in terms of what level of staffing is available. A lot of municipalities in Massachusetts do not have sufficient staffing to comply with mass general laws, such as food establishment inspections, septic inspections, and on and on. I'll leave you with that horrifying thought and let your imaginations go wild with what that can mean for the average person. And when you walk into any food establishment all over in Massachusetts, I would say by and large, we do a decent job given our funding, but we could do a lot better. That's my 2 cents. And in general, I would just say, you can imagine where there are underinvested and under-resourced communities, what that means and what that means for health equity.
Beautiful. Thank you, Ellen. That's very well said. And what this will do is hold the Massachusetts Department of Health more accountable for health outcomes by asking people who live in diverse geographic locations how they can offer more efficient and more effective local public health services. Okay, next slide. And like we said, we'll have time for questions and answers at the end. So please, if you have any other questions about that, we'll happy to talk about it. Our next issue comes up with the current problem we're having with midwives in the state. And really, this state is at it's at the bottom of the third of the states for midwifery integration. We have no insurance or very little Medicaid coverage for most home births. No state recognition of licensure for certified professional midwives credentialing, despite being, in most states in the country, 37 other states have that. And then a lack of integration of care across home and hospital settings, and only one freestanding birthing center left in our state with the closures of Cambridge Birth Center and the North Shore Birthing Center. And really, families as well as birthing moms, they really need access outside of the hospitals. The last place you want to go is a hospital with them being so overwhelmed. So we need to support these types of initiatives. Next slide. So the act promoting access to midwifery care and out-of-hospital birth options is Senate Bill 1457 and House Bill 229. It is sponsored by Senator Roush and Rep. Kay Khan. And we're asking that you have your constituents or your legislators vote favorably for the Joint Committee of Public Health by February 7th deadline. Also, this establishes a protocol for the regulation and certification of midwives. So like a board of nursing that just handles midwifery. And also they'll develop, standards and a standardized test for the midwives to pass. Next. So House Bill 2932 and Senate Bill 764 is an act to establish the family caregiving tax credit. This is a really important bill because it helps with families that have to take care of loved ones. And we all know somebody that's had to care for a loved one in their home or had to take time off work. We know this really affects women because they're, having to take time off work, juggling their schedule, taking care of elderly in their home, their parents or grandparents, that sort of thing. So this establishes a tax credit of up to $1,500 for family caregivers whose gross income is less than $75,000, and for an individual, and then for a couple, if they're making $150,000, they would also receive a tax credit of $1,500. And its eligible expenses would be to improvements they made on their home, or purchasing leasing equipment, or obtaining necessary goods or services. I know it doesn't sound like a lot of money, but any little bit can help in those really dire situations like that. Next slide. An act related to end-of-life options. This is a really big one for me. I was an ICU nurse for 7 years, and I took care of a lot of patients that were really at their end of life. And if they had the choice to, die in the hospital or be able to die at home with some dignity, they would always choose the latter. So this bill is sponsored by Senator Comerford and Representative James O'Day. And we would like you to call and really have them report favorably out on the Joint Committee of Public Health by February 7th. It's going to authorize a physician licensed in Massachusetts to prescribe medication to a terminally ill patient that's, of sound mind. And also the patients have to have the capacity to make and communicate medical decisions, have incurable, irreversible diseases with that would normally cause death. So, these are truly end-of-life patients that need some help that they're not able to get. And a lot of folks have to leave the state and go to other states if they desire to have this option. Ellen, do you have a story for us about that?
I would just say I don't have a specific story, but I would just say I have, just teasing out a couple of the last two bills. I was a caregiver to my father, who was a stroke victim, and he actually did contract. He was his quality of life had gone way down. He didn't have any desire to end his life early, but that decision was made for him anyway because he contracted COVID and he passed away in December 2020. But I would just say that any sort of way that you can give somebody whose quality of life has deteriorated to a degree that is, you know, it's pretty obvious to everybody, including the care team and the family, that the person and they can tell you that they're not having a nice time, and they can tell you in advance, you know, what they want. I think that should be an option, and that's really a human rights issue from where I stand.
Yeah, any way we can relieve someone's suffering, I'm absolutely in favor of that. Thanks for sharing. Next
Yeah.
slide, please. So this is an act relative to birthing justice in the Commonwealth, and it is, let me just make this bigger so I can see this better, sorry. It is sponsored by Senator Miranda, and we ask that your legislators will report the bill favorably out in the Joint Committee of Public Health by February 7th. This will help decrease the high rate of maternal and infant deaths and preventable complications through the ability to have hospital, outside the hospital midwife care, establish a local health agency through the Department of Health, provide postpartum depression agencies through screenings at no cost through Medicaid, sorry. And then also cover doula services during labor and delivery, as well as those visits afterwards when they've gotten home and during any of that postpartum period. So it's really important, you know, the community health worker, we've seen that really a great role for dealing with any type of community health issues. And the doula would be really important in this way too. In December, this was instituted by EOHHS and on 12/23, but passing the law would make this permanent. So we're really in favor of this one as well. Next. All right. Back to you.
Great. Thank you, Ellen and Andrea, for sharing your personal experiences that are very powerful and a testament to all the work we have to do to improve healthcare in Massachusetts. I'm going to stop share. The remaining slides are just contact information and resources for you. So I'm going to stop share, and then we can open it up to questions. If you'd like to use the raise hand feature and come off mute, you're welcome to do so. And we can also check the questions in the chat.
There is a question in the chat from Eileen. She says, what is the State Department of Public Health's role in H4101? Historically, the department collected the data that this bill is addressing.
Is that the SAFE 2.0 bill? Is that the Regional Public Health 4101? Let's see.
I believe so.
Oh, great. You know, I'm not exactly sure, but we are in a coalition with the Massachusetts Public Health Association, and their legislative director worked very hard to help write the bill and get the bill passed. It actually got to Governor Baker's desk last session. So we anticipate it will pass and get to Governor Healy's desk this session. But I'm sorry, I don't know the answer to the question, but I can follow up with the Mass Public Health Association and let you know, unless Ellen or Andrea, if you have information.
I do have something to add.
Great.
So a lot of times, actually, even recently, local boards of health are interested in, like, how are we doing information from the Department of Public Health? And it's very difficult to get that information in a timely manner. For example, we are looking for how many residents in fill in the blank municipality have gotten their flu shot this year. And only recently, and actually only because of COVID, there was a, in fact, influenza-like illness dashboard released. But local boards of health were not involved in developing it, and local boards of health were basically passive recipients of the data. And it was actually insufficiently drilling down into neighborhoods, demographics. It was just really broad. It wasn't, and traditionally, I will just give you a little bit of background. people are very protective of their local information. They don't want to be able to compare apples to apples. Like they don't really want to know what DPH doesn't really want like my town to know what's happening next door, which I can't understand because as we all know, COVID doesn't care about the border between two towns. I would just add also that there was an information sheet circulated from the Massachusetts Public Health Association, and it said what was, it talked a little bit about the role of the Department of Public Health, and basically in terms of what are their requirements for data collection. So they're going to create a uniform data collection and reporting system with this bill if it becomes a law. Developing a unified data reporting system that includes metrics for inspections, code enforcement, communicable disease management, and local regulations to track statewide progress and protect public health. You may or may not know this, but a lot of other places in the United States have more of a county or a regional model. And for historic reasons, and like I said earlier, home rule, we've got, instead of 4 regions, we have 351 cities and towns. And this would require them to do reporting into the Department of Public Health. Whether it comes back out to the communities is a different question, but it would require collection of that data I believe under the law. So that's my understanding.
Thank you, Barb. This is Eileen, and I thank you, Ellen. I just want to tell you where this question is coming from. And it's really very sad that it's gotten to this point. I was commissioner of mental health in Massachusetts back in the late 80s. And that's quite a while ago. But the point I'm raising is the Department of Mental Health, and I'm just talking about the EPH, did collect this data. And the data was quite comprehensive. And yes, there's always been this issue across Massachusetts, depending on what region you live in or area, of data, who has the data, and I'm going to protect it. But they were able to attain it, and there was a lot of work. And so therefore, as important as this bill may be, it's the operational aspect that I'm concerned of because of the culture in the state. And you also described it somewhat, Ellen, and that there has to be a way that the governor says, under my authority, and under the commissioner, I believe it's still a commissioner for DPH, that this is what is expected and this is how it shall be done. And we're going to work through the process and not hold it under, quote, my armpit. And that operational issue is as important as the bill is.
I couldn't agree more. When people say, oh, we don't have nothing to worry about in Massachusetts, we have cultural issues to worry about. Commissioner Elias, thank you for telling me about your history. I did not know that. If I may call you Commissioner, I think you
No
deserve
need
it.
to. I'm Eileen.
I think you deserve it, but Eileen, we can be friends. Yes, we have to look in the mirror every day and hold ourselves up to high standards. I couldn't agree more.
I'm just repeating that maybe this bill will go through, but if it should not, there are operational ways that the governor can work with the league and whoever she designates to attain this data. That data is there.
I mean, we know you can pass any bill. Obama said it. He said you can pass any bill, change any law, but if you don't change the culture, you haven't done anything.
You got it. Thank you.
Eileen, we are definitely going to call you. I'm going to put you in touch with Mass Public Health Association because I think you bring a very valuable perspective that they may not be aware of.
Thank you. History, there's a point in going back in history and seeing what was done. Thank you.
Kathy? Hi, Kathy.
Hi, Jen. I have a question about the midwifery bill or bills. I'm a little confused. I don't know the details, but my question, well, I'm excited that one of the bills would make it accessible to people to get them out of the hospitals and be able to have their births at home. Now, I have experience with my daughter. She had two midwifery experiences, one in Western Massachusetts and one here in Beverly, all in the past 6 years or 10 years. And they were absolutely phenomenal, incredible experiences. She had to save money she wanted it so badly, she saved money to make it happen. But what my concern, and it might be taken care of in the bill, I do not know. My concern is what is the extent of the licensing for these midwives who have been practicing for years and years and years. That they were so competent. I was there for both births. They were, I mean, I vouch for how absolutely phenomenal, incredible the experience was for her baby, myself, everybody. But what's the word? Not challenges, or are these midwives going to have to, the current ones that are excellent, are they going to have to go back to school to get their license? Or is
No.
that taken care of in the bill?
It's funny, it typically how the Board of Nursing has handled this type of thing is they'll grandfather in certain people that have been working in an area and then allow others to have to fulfill certain, requirements. So I don't know how that's going to work out. I think it's more they're going to pass the bill, and then once they build this board of people and they, figure out what the requirements are going to be, then they'll do that. But typically those folks have been grandfathered in because we've seen changes through nursing throughout the year and over the years, and it's usually done that way so that you don't have to start over or quit because you're not going to go back to school.
I hope so. That'd be great. Thank
Yeah.
you.
There's a question in the chat from Patricia. She says, these are all compelling bills. Which ones have the best chances of getting to the floor? Is there any quantifiable fiscal impact information on any of them?
Great question. We definitely expect the SAFE 2.0 to come to the floor pretty soon. I would expect a lot of movement on midwives. We just have to play it by ear. So the reporting deadline for most bills is February 7th. So that's next week, where they have to be reported by all the joint committees. That's all close to 8,000 bills this session. So they could either receive a favorable report and move on to Ways and Means or healthcare financing, or they're sent to study, or they receive an extension. But there's going to be a lot of movement in the next week. Midwives is a really hot topic. A lot of the bills, I believe it's the Medicare for All bill. If you click on the link, we'll share the slides tomorrow where you can click on the link, and it does have a fiscal note attached. So there are costs attached to the bills. So if you go to malegislature.gov and type in the bill number, or you just click on the PDF that we share with you, you can check the bill history tab. And one of us is happy to show you. If this sounds too complicated, don't worry, you don't have to remember. We're happy to walk you through it if you email us at specialists@lwvma.org, or me or anyone, and we can walk you through how to check. But many of the bills will have a tab that says fiscal note when there are costs associated with it. So in healthcare financing, they assign the costs, or if the bill is leaving, let's say, Public Health Committee and gets reported favorably to Ways and Means, that's the time where the Ways and Means staff assigns the costs to it. So if there's no fiscal note now, there will be when it's reported. Sharon?
Hi, forgive me, I was a little late to tonight, but where are we on single payer healthcare?
Thank you. Yes, I spoke to this. It was the first bill we talked about.
Okay,
It
apologize.
has, It has, it's currently in the committee and we're hoping it will be reported out by March 27th. We would love if you could contact your legislator and encourage them to co-sponsor and or if they're on the committee to vote it favorably out of committee.
Okay, thank you.
You're welcome.
Barbara?
Yeah, I'm asking a question about something I know relatively little about, and it's the caregiving for the caregiving getting the $1,500 credit. But is there ever any pressure to try and even pay for them? Let them be paid for the work that they do. I don't know, does any state or has anybody figured out how to do that? I worked on a program at the university where we paid for the incremental cost of childcare. So when professors went to conferences and so forth, they could pay for childcare. And many of them, I'd say a third of the 150 or so that we worked with, didn't want to use professional caregivers. They wanted the people that the kids knew. And I imagine it would be the same thing for an elderly person as well. And so we let them do it. We said, great. They had to tell us and they had to give us a report, and they also had to advocate for paying for that, for childcare. But I just haven't heard if there's any pressure to do that, or if anybody's ever figured out how to keep it from being some kind of slush fund or something that people would think would be abused, but wouldn't be.
I'm sure it's been, I've read articles about it and I know there's talk about that, but I haven't seen any, legislative moves towards that. I don't know if anybody else has any stories from other states. It's definitely becoming more of an issue. So I expect that we'll be having this conversation more and more.
Well, if you do, let us know. If you hear of any, let us know.
I will
Please,
do some more
thank you.
research for you.
Oh, Eileen, thank you for sharing the event in the chat. I welcome you to post that to League Leaders Google group. So, more folks I'm sure would be interested. That sounds amazing.
We will.
And I also notice Chris Flory's comment here, there should be relicensure requirement for midwives. All medicine changes rapidly. Agree 100%. Yeah, there should be relicensure requirements. So, and I think that would be required as well. So they'll come up with some standards that everyone has to be, capable of doing. And I don't know if it'll be part of a test or how that works, but making people go back to school all over again probably won't happen, but there would be some standards that they would have to meet. So not to worry, they will make sure everyone's safe doing that skill.
Wonderful. Any other questions, comments for Andrea and Ellen? Great. Okay. Thank you, everyone. We really appreciate you coming, and we'll be sure to share this recording and slides with you tomorrow, and hope you have a good night.